In the summer of 2021, I was listening to a podcast. I like to listen to a podcast as I run, and it was a Freakonomics podcast talking about living kidney donation. In October 2021, I got a job at the Ascension Seton Foundation as the Director of Grants. I've had a background in non-profit healthcare. The opportunity came up to write grants and seek funding for Seton Medical Center, and one of them was the transplant center. I knew it was opening up in November, and I wanted just to learn more about the opportunity and the process of potentially donating my kidney. So I called Katie at the Seton Medical Center. She answered the phone and I said, well, I'd like to donate my kidney. And she said, sure.
I get this phone call from this lovely woman and she tells me that she wants to donate her kidney. I literally froze. She filled out her application, did everything that we asked her to do. We all just rolled with the punches and she gave us her timeline and everything just set in stone from there.
I was invited to Seton for a full day evaluation in December. That's where I met everyone on the team. I met the nephrologist, Dr. Lee, and I met Dr. Turgeon, who was the person who was going to do my surgery. The more I did it, the more I thought, yes, I do want to do this. I'm healthy. Why wouldn't I do this? They approved me to donate, and they said, we'll find a match through the NKR. The NKR is a national kidney registry, which is a national organisation that find kidney matches across the country. So at the beginning of 2022, January, after I'd been approved, they started to work with the NKR to find a match. And then in February, they found someone, and I just knew that they were female and living in New York. And then they set the surgery for the end of February. I checked into surgery. I got to ring a living donor bell and everyone clapped and cheered as I was wheeled down the hallway. I woke up and surgery had happened. It was a few hours later and Dr. Turgeon was there saying that everything had gone well. I said to Dr. Turgeon, did the kidney make it? And she said the surgery was, went well, it was successful and my recipient was recovering well.
Victoria is our very special first and altruistic donor, which means that she gave her kidney without having any other recipient attached to it. She started us on our way in the Living Donor Program and has been with us every step in our journey to growth. So not only did she give her organ, but she continues to give to the program and is continuously finding ways for others to give. We're forever grateful for her role in our program.
At the 2-week follow-up, my social worker gave me a letter, and it was a note from the recipient's mother. And she had donated her kidney and was a living donor because she wasn't a direct match for her daughter. So as part of the NKR, they were able to find a match with me. In February of 2023, I went to New York with my husband and we ended up meeting my recipient and her mum. It was lovely to learn more about them and get to meet face to face.
I came here as a result of this community not really having a strong transplant presence and patients needing to travel far distances to be able to get their transplant services. We've been very successful in building the kidney transplant program, so much so that we've grown and now have a new transplant clinic space here in the hospital. And we're hoping to continue that growth and start thinking about building the liver transplant program in the near future.
Having the transplant center here at Seton, right in the middle of Austin, for the community, knowing that people come to receive great quality care, knowing that they need that life-saving organ, is motivating me. Having the ability and the funds and the resources to grow the care team and invest and support patients that don't have those resources, yet they still need an organ.
Philanthropy is an important adjunct to what we do. It helps us with research opportunities. It also helps us innovate and try new ideas. And then it can help us with supporting our patients in their journey to come and get their transplant here. Not all patients are from Austin, and some of them, especially their donors, may travel long distances to be able to be a living donor for their loved one. So that philanthropy can help us in those circumstances with housing and some of the costs that they need to pay for when they're here donating an organ. Living kidney donation really transforms lives and can really make a difference in taking someone who has organ failure and is really struggling to someone who is now enjoying life and doing the things that they weren't able to do before their transplant.
The care that I received and the compassion, it was so positive, everything. I was very fortunate, I think, to have health on my side and fitness, and then the care team that understood where I was coming from. Afterwards, just before getting discharged, the transplant team all came to see me in my room and they presented me with a Donate Life flag. I would donate my kidney all over again if I could. It was just an opportunity to make a difference.